we can have, yeah, Katie and Courtney up together. Okay, wonderful. You guys can come on up, and we're going to really talk about the continuity of what Wendy talked about earlier, in terms of like, now what can we really learn in our AP rearrangements and multidisciplinary care. And so we're really excited to have the two of you up here and talk to us from Children's Hospital of Colorado. And so I think there's just a lot of great promising things that we can do together. So come on up, and thank you for having us. Thank you. Yeah, you
can. Thanks everyone for being here. Hope things are going well and everyone's enjoying their time here so far. So I'm Katie. I am a genetic counselor. I am lucky enough to be involved in the new clinic that we just launched yesterday. I'm really excited to get to be part of that. So we just wanted to chat a little bit today about how genetics and genetic counselors can be involved in an ongoing conversation about AP, and how multidisciplinary care can be helpful in kind of walking through that diagnosis. So I have some slides. I don't really need to formally go through them. I just kind of wanted to talk a little bit about what the genetics piece can do after an initial diagnosis has been made, and then take any questions that you guys have specifically about genetics. So I guess a little bit about what genetics is and what genetics can do. Genetic counselors are people who kind of help to walk through the complex things that come along with a genetic condition. As you guys know, especially with AP, there's a lot of different types of changes that can be seen, and those reports can look super complicated. There's lots of numbers, lots of letters kind of thrown into that report. And I think that a lot of times when that diagnosis is first made, there's so much information that's thrown at all of you at once, and you have to be thinking about, what types of things do we need to be worrying about for our children? What types of specialists do they need to be seeing? What tests do we need to do? And I think sometimes that genetic piece can kind of get lost in all of that chaos. So I think that even though the diagnosis for many of you has been made years ago, I think that genetics can be a helpful part of an ongoing conversation, just because we can circle back to any questions that weren't addressed when the diagnosis was first made. I've also heard some kind of horror stories from some families about how that initial conversation went when they were first diagnosed. And I also hope that, through multidisciplinary care or through just being involved and speaking with genetics team, we can help to kind of correct any of those not so great conversations and help to walk through things that maybe you didn't get an opportunity to talk about the first time around. So I kind of want to just open it up and see what would be helpful for you guys to talk about. If there's anyone who hasn't really had a chance to have a genetic counseling conversation, what types of things would you guys like to discuss? I want to keep it kind of informal. Either way. Yeah. Mm-hmm. Yeah, I think that's one of the challenging things about making a lot of different genetic diagnoses is things can be so variable. And that's one of the first questions a lot of families ask is, well, what can the genetic testing tell us? Does the size of the duplication determine what things are going to look like down the road? Can we determine anything specifically from the results? And I wish that we had a better crystal ball to give families, because those are very understandable questions. But a lot of times our true honest answer is we just don't know what to expect. And so, a genetic diagnosis can give us a starting point. It can give us an understanding of why certain symptoms are happening. It can give us kind of a roadmap for, what do we need to be looking for? What types of things do we need to be watching for? What kinds of supports can we put in place throughout the course of a child's life? But it's never going to tell us exactly what to expect. And I think that's one of the biggest things to keep in mind is this is a diagnosis that tells us one piece of a child's, medical history. It doesn't give us all the answers. And all of those other things that go into, care are just as important as the genetic component. Is this child getting therapies? Do they have a loving, supporting family that's taking care of them and that's making sure that they're getting everything they need? Those things are just as important, if not more important. So I always like to remind families that we are human beings with 22,000 genes, and this is just a small portion of that. So it doesn't tell us everything, as much as we sometimes wish it could. Yeah, exactly. So sometimes a genetic diagnosis can be really powerful in advocating for those types of resources. I always tell families, use this as something that's going to help you get what you need and what your child needs. Don't ever use it as something that's going to hold you back or limit what they can do. Yeah. Oh, no, it's okay. Go ahead.
So I still have it. So my question would just be about actually best practices and talking to a family. I think we are. I wish it had gone differently for us when we, kind of found out this whole business at the beginning. And how should it happen? In terms of like, leaving the NICU, have results, haven't told the family yet. You know what I mean? How would you really walk? How would you? What would be considered best practices in your profession?
I think that's a really good question, and I also think it's hard to answer. For me, it depends so much on that specific family and kind of where they're at in that journey. So are they just leaving the NICU? Are they caring for someone for 20 years and just getting this diagnosis? So I think it kind of depends where they're at in that journey and kind of meeting them where they are. And also meeting them where they are in terms of understanding. Do we need to go back to basics so that they can understand what that report is actually saying? Or do they want to more focus on what to expect going forward? So I feel like I never have the same initial conversation twice. Just kind of going with what questions is that family asking? What are they needing from me at that moment? And then just having a plan for follow-up so that once you kind of absorb the initial shock of the diagnosis or the initial relief sometimes of a diagnosis, having an opportunity to come back and ask those additional questions as they arise. So I think that brings us back again to the benefit of multidisciplinary care and having a team to follow up with over time is it gives you a chance to answer those new questions as they come up. I don't know if that answers your question very well, but
It did. Thank you so much. And I will say from the healthcare consumer perspective, having that conversation, if it has to be virtual on, video or in person versus the phone, I think could make a big difference.
I completely agree. Yeah. COVID and doing a lot of things via telehealth has been challenging in ways, but it's actually been nice sometimes to be able to have that conversation over telehealth because the family is kind of in their own space. The child can be comfortable doing what they want to do. They're not trapped in an exam room fighting to get out. So sometimes it can actually be nice to be able to have the family in their comfort zone when we're sharing news like that and knowing that they don't have to leave the hospital and drive home after hearing that news, and being able to just do what they need to do and have the support system around them that they need. But I completely agree, face-to-face, whether it's digitally or actually in person, is definitely preferable than just a phone call. I don't know how to. I don't know how to answer that. Yeah, I'm always Yeah, I'm always happy. I'm going to share my contact information and everything. So if anyone has questions that were not answered at any point by a genetic counselor, please feel free to reach out. I love chatting with families and walking through reports, whatever is helpful. And then I feel like we're also pretty good at providing resources. You know, you guys are the experts in the diagnoses that your children have, but you might need help communicating that to other people. New teachers, family members, friends that want to understand, but maybe, you know, obviously don't have the same experiences that you do. I think we're also good at helping navigate those types of conversations. How do we, you know, talk to siblings as they get older and they start asking questions? Just kind of incorporating your whole family and your whole network into your child's diagnosis. And I think those things and, you know, that network of people changes and evolves over time. So.
When we got the initial diagnosis in the NICU, and then we've seen a lot of people say, "Oh, are you following up with them?" And we're like, "Why? What's the point?" So can you delve into that more?
Could you repeat the question?
Yeah, so the question was, you know, is there a reason to continue following up with the genetics team over time? And again, I think that that's different for every family. You know, there are several different clinics that I am involved in that are based on specific diagnoses. And there are some families that I see once a year and I go in for a few minutes and say, "How's it going? Do you have any questions?" And they say, "We're good." They say, "Okay, see you next year." So like, you know, there's a lot of families that don't need to keep having that conversation. And it might, you know, you might go 5 years without really having any genetics questions, but then if one of those questions pops up, it's nice to have a team and have someone that you can reach out to. So I don't think it's something that you need to be doing consistently for every family, but just having that network and having that resource is key.
I just wanted, I don't know how many of you guys were in there for the speaker via Zoom, Emily something crazy last name, but she did a research study of the last year, and she said she found that parents only got 10% of the information between the emotional distress and so many big words. And so I think what like a great answer would be like, even if you got a great first meeting and nothing has changed, you probably only got 10% or maybe a little more, still not a full picture in the one meeting. So continued appointments would just help your brain, you know, hear the message over and over again so that the information can sit.
Definitely, totally agree with that.
But I also wanted to say, so we met Katie yesterday, Lainey and I did, and she said something that I was told, so we had like the results of our microarray in a phone call, but we couldn't get into the geneticists for like 6 months. So a lot of the particularities were not explained initially. So I don't know how many of you guys did this, but I like relived every day of my pregnancy thinking like, I did this somehow, like that had a glass of wine I shouldn't have had, you know? And so she reiterated this, but I hope you guys have all heard by now. It's nothing you did.
Yeah, and that's such an important piece because so many families carry that guilt around and carry that what if, and do the same exact thing that you were saying, relive that pregnancy and say, was it that glass of wine? Was it that time that I fell down? Was it that flu that I had? And being able to answer that and put that out of people's mind, I think it's really, hopefully really helpful. We know that this is something that happens before conception. It happens pretty much years before children are ever even thought of, because it's usually a problem that happens when the egg cells or when the sperm cells are initially formed. So it's nothing to do with the pregnancy. It's nothing to do with the parents in almost every case. So yeah, I think that's the other piece that genetic counseling can bring, is that support and that reassurance that it was nothing to do with parents.
Maybe a good segue to the multidisciplinary care model. And I'll just say I'm Courtney Santucci. I'm a pediatrician at Children's Hospital Colorado and one of the participants in our, well, it's a program. So it's obviously the first 8P and Ring 14 clinic yesterday, hopefully to continue on into the future. But we've also been caring in that same multidisciplinary way for patients who have Batten disease, which is a neurodegenerative condition. also caused by a genetic change. And the team that we've brought together involves a very skilled neurologist, Dr. Demarest, who's sitting in the back of the room there, and physiatry, so a rehab medicine pediatrician, who really takes their purpose on the team is to pay attention to musculoskeletal development, tone, screening for neuromuscular scoliosis, hip dysplasia, proper use of adaptive equipment such as bracing and other adaptive devices. Let's see, who else is on that big old team? Lots of therapists. So PT, OT, speech, with a particular focus and use of augmentative communication and making sure that we're thinking in a smart way about what device to introduce and thinking about what we know about the projected course of that child's development, and when to introduce different communication devices. And then me, I'm the generalist, right? So I'm a pediatrician who's got sort of a weird practice. I base out of a clinic called the Special Care Clinic at Children's Colorado, which is a clinic for about 5,000 children who have complex and chronic medical conditions of many sorts. And my particular focus within our group of 13 pediatricians is more neurologic diagnoses. And that's, I think, why I was recruited to be on this team. But the generalist on the team really is the one who's going to pay attention to nutritional and overall developmental aspects of the diagnosis. And I think what I maybe bring is a view on things that are actually shared between 8P diagnosis and other conditions which may impact similarly on development, ambulation, other skills, and look for common themes and just bring experience from having cared for several thousand now other kids who may struggle with, like the constipation issue that was just presented is when in yesterday's clinic, every single patient, there was something to be said about that issue of constipation. And I do think that sometimes it's those little things, right, that can impact greatly on the child's comfort and frustration and behaviors and sleep patterns. And if we can just solve the poop problem, sometimes we can make a lot of headway in other areas as well. So we do kind of work together as a team, each bringing our individual training and experience to bear. And obviously with the AP group, we're just getting started, but all of the members of our group have already many years of experience caring for other complex kids. So we're just very excited that the group is here and is participating in our multi-D clinic. Happy to answer questions about the program that's here. And maybe for those who don't live in Denver or for whom travel back to Denver on a frequent basis is not feasible, how might we take elements of what we're doing here and help you to translate it to the care that you're getting closer to your home? I have no idea how much time is left in this session.
Okay, there's so many. I think a lot of you that were able to meet Dr. Santucci yesterday, I mean, we're so excited because you really have captured the heart of we just have basic day-to-day questions about, right? How can we make our AP heroes' lives better? How can we and we have Ring 14 families coming into this room right now as well. And it's almost that simple. And so we talk about the complexities of the genetic rearrangements, but that's not our day to day, right? We're not thinking, oh, this is an 8P deletion and what am I going to do? We're like, she just can't poop. And so we're so hopeful that having really quality multidisciplinary care can improve and answer these day-to-day questions that we have, right? What happens prepubescent? What happens? What should be concerned about? And hopefully as a group, we can be as forthcoming as possible about what we're experiencing so that you can actually help us.
Well, and I think the exciting thing about bringing a group together is that you've got people in your lives who are of varying ages. And so the specialist group paying attention can sort of then help those younger children who are coming younger in the diagnosis to be able to answer intelligently when questions are asked, like what can we expect when puberty hits? What will that do to epilepsy severity, for example? I mean, we can give a generic answer, which is like usually not great things, but you know, it's really hard to know specifics until we've cared for multiple patients with the same diagnosis, and this is rare, as you all know. So yeah, yes.
There can be a centralized location where we can actually access this data, because right now, obviously, we can contact you, we can ask those questions, but sometimes we don't know the questions to ask. And so one of the things that we found really helpful is, and unfortunately it happens all over Facebook, but we read through and go, and even if we didn't think we were part of the conversation, you read through the comments and go, oh, we have that too, but didn't know it was this. So is there a way for us to be able to access the data in a platform that isn't just by asking questions?
It's a good question.
That is a perfect segue to our next session. Like, I mean, a perfect plug. So what will you be joining us for the birthday party? You're invited. She's invited. Only just because I know that you guys probably have some more questions, but I wanted, it's just been such a long day, and I know that all of you guys are just trying to like stay brave through this. So, you know, is it okay if I just suggest that if there's questions, you're here for a little while, and I'll introduce